Welcome to UCSF. We're delighted to welcome all of you, donors, our faculty, staff, our students from UC Berkeley, and our students from City College. Welcome to our institution. We're delighted to have you here. My name is Alejandra Rincon. I serve as Assistant Vice Chancellor and Chief of Staff for the Office of Diversity and Outreach. And I served in that capacity for about 10 years, building our office, which has been a very exciting time. I'll begin with a bit of history about the office just to contextualize this work, and then we'll kick off the program. Jeff wanted to give you very special thanks for inviting us and for the partnership with our office and with our Center for Science and Education and Outreach, and my colleague Gina Intinarelli with Population Health. Thank you, Gina, for all the support and the partnership with our office. So. Not to go too far into history, but this is a workforce program, and I thought it would be very appropriate to talk a workforce moment that happened here at UCSF across the street at 500 Parnassus at the hospital. So back in 1968, after Dr. King was killed, there was a group of workers, janitors, that organized because they couldn't use all the spaces throughout the hospital. Even though they worked throughout the 15 floors of Moffitt Hospital, they were relegated to the basement of Moffitt Hospital if they wanted to use the facilities. That is, if they wanted to use the bathroom or the cafeteria, they could only use the basement, again, even though they worked throughout the different floors. So after Dr. King was killed, they organized, and in 1968, they created the Black Caucus, which is the first staff organization, the first African-American organization in the whole UC system, which is a very incredible thing, because oftentimes when people think about UCSF, they don't think of us as, the activist campus or the progressive campus, but we are, and we hold, a lot of honorific titles. One of those, again, is to have the Black Caucus, which actually this coming Saturday will be hosting their gala. So they've been around for over 50 years, really providing fundamental support to the campus. And we really see that moment as a seminal founding moment for our work in equity and inclusion. And it is very fitting that it was a workforce moment, really the working conditions of these janitors that really led to the strike. It was called the janitor strike by the basement workers. If you go on our website for the Office of Diversity and Outreach, you can see, the footage, from that time. And it was them at that point pushing the administration for better working conditions and for increasing access for African-American students and other minorities to the School of Medicine and the other schools. So we definitely stand on their shoulders. And for those of you who are, young people pursuing your careers in the health sciences, we're delighted that you're doing this work, that you have chosen this career. We certainly hope that you think of UCSF as a place to come. But we also have to remember our history, because there were some people that, really led the path. And when you think about janitors, walking out of their jobs, with very little incomes, to really set the stage and the path for us. Fast forward to 2010. In December of 2010, students in the School of Medicine really pushed for UCSF to have an Office of Diversity and Outreach. And in that year, in December of 2010, we had the inaugural Vice Chancellor of Diversity and Outreach, Dr. Renee Navarro, who sends her regards. And since then, we've been building this office. We started with an office of 2.5 people. We are now over 53 people with 7 affiliate faculty. So we are a thriving unit that does a lot of work. And part of our work is to support workforce initiatives through the Center for Science, Education, and Outreach. That center is key because since we don't have an undergraduate campus, we have to be out in the community, letting the community know about UCSF, about our careers in the health sciences, and having them imagine them here. So we partner with 7 school districts in the Bay Area. We work with students as young as 4th graders on a summer science camp when they come to Parnassus to learn about careers in the health sciences. And a lot of the opportunity to work, with Jeff and with Gina and with all of you here is through our Center for Science, Education, and Outreach. The other key thing that I wanted to mention in closing is a lot of this work that we have done and that we have began doing, we have accelerated in the past 4 years. And I wanted to acknowledge the moment that accelerated this work, because it is a tragic moment in our national history, and it's the killing of George Floyd. But it was a moment that served as a catalyst for this work. It allowed us to organize all of our initiatives under the Anti-Racism Initiative, which is an initiative of Chancellor Hogga's cabinet, and it has 7 different pillars. One of them, which is to be a better neighbor to the San Francisco Bay Area, meaning to create increasing hiring opportunities for residents of the Bay Area, to increase our procurement spending. We spend over $10 billion per year, so increase that spending of our budget with communities of color and minority businesses, and to increase our educational opportunities for low-income students of the San Francisco Bay Area. That is so that more students that look like you think of this as a great place to come and start your careers and hopefully continue your careers, become alumni, come back, give us some funding and allow us to keep our work. So with all of that, welcome to UCSF. Enjoy your lunch. Welcome to this wonderful program, and thank you for the service that you do to all of our communities in the Bay Area. Thank you.
Thank you, Dr. Rincon. It's really an amazing honor to have the Office of Diversity and Outreach kick off this symposium, in part because when we decided to expand our program, the Patient Support Corps had been working since 2012, 2013 with Berkeley students. When we wanted to expand, in 2019 we had a meeting with Chancellor Navarro and Don Woodson in the Office of Diversity and Outreach. And we really got embraced by that office and guided in our work very strategically. And since that time, we've accelerated our progress. And so I really have to attribute much of our success to the collaboration and the guidance that we've received from your office. So thank you again for that wonderful welcome. And I want to just mention that at that meeting in 2019, we had Suzanne Badenhub and Guy Lampard, who couldn't be here today and send their regrets, but they were part of the visionaries. Guy and Suzanne are also supporting an organization called 10,000 Degrees, which is also represented here today, and which is all about student success and being activists and advocates for students from underrepresented backgrounds. And Guy and Suzanne and a number of other supporters got together, and we held a few salons. And Elena Chavez Quesada and others from the Chavez Family Foundation also supported us, along with Dick Barker and other individuals, too numerous to name actually right now. But this support was really visionary support for our program to say, hey, this internship program that you're building, this can become a model and it can actually create systems change. And so we had a few salons, which were very small events. And then Ian Shore, who's our co-host today, and we'll be talking more with Ian later, had this vision for a symposium. It's time to actually, invite more people and share the news. So we're going to do that, and we've planned a very exciting event. Before we get started, well, as part of our getting started, I thought it would be good, in education there's an expression of show, don't tell. So I'm going to come back and I'm going to do a little bit of telling. But before we go into the story behind the story, I would like you to really hear and have an image of what the program is. The truth of this program is represented by our students, and in particular, Alondra Camarena, if you would come up, Alondra. Alondra is a senior at UC Berkeley. She joined our program in 2020 as a first-year student, and she's going to tell you a story, and if really all you take away from today is the story that she tells you, you will have understood the truth about our program. So, Alondra, please come on.
All right, thank you, Jeff. Good afternoon, everyone. I hope you all are having a good day. Today is a very special day for me. I'm here at Parnassus and with my mom here in the crowd. And we're here discussing an innovative approach of how we can diversify and address gaps in our healthcare system. However, my parents and I are typically here at UCSF for different reasons. On May 9th, 2008, my little sister, Elizabeth, was born. She was born in my hometown of Tracy, California, but due to complications during birth, she was transported to UCSF, where we later found out she has spastic quadriplegia cerebral palsy. And it was a difficult time for us. We spent a lot of time here at Parnassus, And though I was only 6 years old, I have a lot of memories of this period in my life. I remember holding my sister for the first time. I remember the nurses having me and my brother draw pictures to hang in my sister's crib. I remember begging my parents for Panda Express after growing tired of the hospital food. I also remember all the support that we received from family and friends during this time. My cousin from Salinas would take care of my brother while my parents were in the hospital. My uncle found us a medical malpractice lawyer. At UCSF, I remember the volunteers who ran the activity or the family room that me and my brother used to play the Wii in. I remember the chaplain showing us magic tricks after speaking with my parents. And these are just some of the things that I remember. And this is coming from a child's perspective and a child's memory. I'm sure that my mom could say more about the additional support she received behind the scenes. But just kind of emphasizing that support for family and their patients truly takes a village, and that medicine it's a team sport. And one memory that particularly stands out for me during this time was when my father used to take me and my brother to Golden Gate Park to escape the hecticness of the hospital. We used to walk around, go to the markets, get some snacks, and spend the day exploring and playing around the park. And this particular memory resurfaced about 1.5 years ago when Jeff and I first visited Parnassus to start designing a new internship program for the kidney transplant department. And I remember we went up to the 9th floor and we sat in a room that overlooked Golden Gate Park. And I remember thinking, oh my gosh, here I am in a room with Jeff Belcora and Chris Freeze discussing the intricacies of kidney transplant and brainstorming ideas for our program's goal of improving living donor outcomes. And it was a surreal moment for me, and I took a step back to reflect on the position that I was in that day versus the position that I'm used to being on the patient side. And I just know that if I could go back and tell my younger self and tell her the position that I was in that day and the position that I'm here today speaking with all of you guys, that my younger self would not believe it. But I remember that day I asked Jeff to take a picture of me sitting in that room that overlooked Golden Gate Park, the same area that my father used to take me and my brother to, because I just wanted to capture that moment, capture that memory. And after that meeting, I was feeling a bit emotional, and I called my mom. Sorry, Mom. And I called my mom, and we were both getting emotional about how far we've come and how I'm reaching the goals that my child self set out to do. So yeah, this opportunity, this chance to share this moment with my family. Mom, you're gonna make me cry. This chance to set out the goals that my 6-year-old self, hoped for would not be possible without the Patient Support Corps. And thanks to the Patient Support Corps, I've gained experience as a healthcare navigator and as a as a coordinator for a patient support program that's growing, and which we'll hear about later today during the transplant discussion. But I feel great confidence and excitement about being able to pursue my goals of becoming a nephrologist in San Joaquin County as my community faces a shortage in physicians. So I would just like to thank Jeff and the Patient Support Corps in helping my 6-year-old self reach the goals that she set out, and for helping my current self and actively working towards those goals. And thank you to my mom for being here. We've been to UCSF many times before, but this is the first time we're here because of my experience of contributing to a program that's changing healthcare. So it's a really special moment for us. So I know I'm gonna ask Jeff to take a picture of me again because I want to capture this moment. It's another great memory for my journey. But yeah, I'll hand it back to Jeff so we could talk about the lessons that we've learned and what we want to share. Thank you, everyone.
Can we take a picture now? Claudia, would you come up and take a picture? Yeah. Oh, come too. Come. Sorry, we're interrupting this program because yes, we just have to. We're just meeting for the first time, but welcome. Thank you. Thank you. Well, that's an emotional moment. Let's see here. Okay, well, we have designed quite a program for you. The first thing I want to do is thank everyone who made this possible. So, as you know, an event like this takes organization behind the scenes. Ian Shore has been really the co-host and architect of this symposium. So I need to thank him. He has an entire team in the University Office of University Development and Alumni Relations, large team supporting his work and this event today. We have all the staff from the valet. What an amazing service we had for those of us who drove, the valet parking, the wait staff, the people who set up the room, the audiovisual people. We are filming today. So we will make, I'll set up a survey later on where we can discuss how we're going to follow up with all of you. So that's really, how we've set the stage for this event. You have come and participated, which is just wonderful. As I mentioned, we previously did much smaller salons, and this represents the first of what I think will be hopefully many symposiums. And if you come back, as I hope you will, I imagine that they will grow, and we will have even more and more people as the years progress. So who do we have? Who did we invite? We invited, of course, we're all patients and caregivers. And Alondra's story is such a powerful story in part because it describes the story of a family as patients and parents as caregivers. And those are the people that we are here to support. And we're also all ourselves patients and caregivers. We all, I'm sure, have unfortunately, experience that we need to have with the medical system at times for ourselves or for our families. The second audience that I really wanted to invite and include is healthcare delivery systems. So the rate-limiting step in expanding our program is to have more sites participating, and I'm going to describe exactly how all that works. But I'm very happy that we started with our existing placement sites, and so we have from UCSF, we have the Office of Population Health, we have the transplant team, we have the Cancer Center. We have also potentially new sites that may want to, we want to expand within those sites, but we also have colleagues who registered coming from SF General, from the VA, and from the San Francisco Health Network. So lots of potential. One of our alums, Thea, is here from Intermountain Health. So I also invited some of our alumni. They couldn't come, but we want to get other programs involved, other healthcare delivery systems from Kaiser, from Sutter. Hal's here from Sutter, Sutter alum. So lots of opportunities really to expand, and so you're in the audience. And then we have a lot of you are educators and administrators and activists for student opportunity, and we have students as well. So I know that we have UCSF educators here. We have CCSF, City College of San Francisco. We have the Chancellor's Office of Community College Office. We have the Bay Area Community College Consortium. We have San Francisco Unified School District. We have 10,000 Degrees. So we have lots of people here who really are, their life's work is about increasing student opportunity and access. And we have policymakers. We have guests from Sacramento and from the governor's office and from the Department of Labor. And we invited some key partners who couldn't join us, but from the California Student Aid Commission, who run a program called the Learning Aligned Employment Program that we'll talk about. And then, unfortunately, Suzanne and Guy couldn't be here, but we invited our generous donors. The Chavez Family Foundation is here. Another one that couldn't be here, I don't think, is the Genentech Foundation. They've also supported our work. So thank you all for being here. And like I said, I think over the years to come, we will grow this already pretty big tent. Today we have really just two goals. We're here to share lessons learned. I think we have really a tremendously innovative program, and it's one that is positioned to scale, and either through our own efforts or through others importing some of the lessons we've learned, and certainly we'll have to learn lessons from other people. So we want to share what we've learned, and then we want your ideas for feedback, your feedback and your ideas for improvement, and your support, because there's many ways you can support us moving forward. So in terms of our program today, we've already heard from Dr. Rincon and from Alondra. I'm going to give you a little overview. So for the next 5 or 10 minutes, I'm going to tell you a little bit of the story behind Alondra's story. And that will be somewhat conceptual, because I want to share with you some of the breakthroughs we've made in designing this program. Then we're going to have a panel with, as I said, the rate limiting step here is getting clinical placement sites. So we're going to have some of our key clinical champions come up and tell you a little bit more about how the program works. And we'll have an opportunity to ask them questions and have a discussion. And then I want to hear each of your voices individually, so we're going to administer a quick survey that I hope you'll participate in. And then we'll wrap up on the sort of home stretch of the program with an alumna perspective from SAFI, representing a little further down the road from Alondra. And then Dawn Davis-Rougeau is going to talk about the Community College Vision 2030 as an example of the kind of policy changes that we're seeing in the state. And we'll conclude with Ian and I talking about a call to action. So, very exciting, I think, agenda and busy. And I'll just start off with a simple, hopefully a simple picture. So if you pick up from where Alondra left off, and we know that we have, Alondra's a Berkeley student. We now also have students from City College of San Francisco. They act now as interns for health navigators. So for example, in Alondra's case, working with the kidney transplant division, alongside licensed professionals and other healthcare navigators. We were talking about this term healthcare navigator. This term comes around because of the need for care coordination and coaching and assistance with scheduling and things that can be done by college students with training and supervision. And so Alondra and her colleagues end up working one-on-one with patients. And the patients now have various conditions, and we work with various organizations that will be represented on the panel that we're going to have in a few minutes. So I just wanted to give you that picture, and the overall theme is to increase the capacity and diversity of our health workforce. So I will now explain, that there are 50 Alondras at the moment. So we have 50 students in the program. And for example, in the transplant division, I think that's 14 students. In the supportive care needs survey, 9 students. The next few rows are Office of Population Health, closing care gaps, behavioral health coaching, the Medicare and ACO populations. That's 18 students. And then Breast Care Center, where this program actually really started with Laura Esserman as a post-bac program. But now we've moved it upstream into pre-health students. So we have 4 undergraduates working in that program. And excitingly, we're expanding to the VA, and we'll hear more about that with our clinical champion there, the Veterans Health Administration, which I hope will become a really large site because there's a lot of need, and it's a very big system. So here's in a nutshell, probably the most important innovation that we're making is to say, look, the world of healthcare and workforce development already has a model of experiential education. So if you look in the middle column here, we have patients who really need personalized care, and that personalized care needs to be directed by quite specialized licensed healthcare professionals. And so the way that those licensed professionals have their capacity extended, and the way that they bring the next generation along, is a very experiential model where medical students and residents and fellows learn to practice medicine or nursing or whatever the profession might be alongside more senior practitioners. And so, you might start off learning let's say as a student, you might start off learning how to make sutures on a pig's foot, and then you might progress with entrusted activities, as they're called. You might progress to other activities that are more and more responsible. You might help with labor and delivery, delivering babies. You might help with other tasks, moving up to where you begin to practice independently. And I was talking to Thea about this earlier, about how as you practice more and more independently, you have different levels of escalation available to you and different levels of supervision. Sometimes somebody is standing right next to you, sometimes they're in the room, sometimes they're in the next room over, and sometimes they're available on call. So this whole model of experiential learning is certainly not perfect. And one of the major gaps it has is that it hasn't produced the equity that we need in the workforce in terms of representation. So for example, in California, 40% of the population is Latina, and only 6 to 10% of the health professionals represent that background. And there are similar discrepancies for Black African American populations, for Native American, Indigenous, and Hawaiian populations. For certain, UCSF has a definition for what's underrepresented. It includes certain Asian populations, as well as just first-generation students. So we need to do better in terms of the pipeline and the pathways to health professions. But this model is an interesting model. And so what we've done in the patient support core is we've copied and pasted that model into the left-hand column here, where there's an enormous and growing need for healthcare navigation and care coordination in the healthcare system. And so we need more and more capacity for unlicensed people to do really vital tasks, navigating patients through everything in healthcare. And so this creates an opportunity for us to have internships where we can bring students from, and we start with students who are in their first year, freshman year. UC Berkeley, City College, will work with more in the future. And we keep them in the program for 3 or 4 years, and they grow in their internships, and they have more and more entrustable activities that are appropriate to the level of unlicensed navigators. So we have this demonstration project. We have more than 300 alumni, and I will tell you that we did a survey. In the survey, we surveyed people who'd been out more than 5 years in this program so that we could see, did they go on to health professions training? 75% had already completed health professions training, and another 18 were on their way. So it's a very high rate, up to 91%, on track to finish health professions graduate education. Now, we can't claim full credit for their success, but certainly the program contributed to their success, contributed to their skills, their experience, their access to role models, their access to mentors. And then with regard to representation, we didn't track demographics all that carefully in the beginning of the program, but we did a survey looking back, and we found that 121 respondents, 38% were from these definitions of underrepresented backgrounds. And then after meeting with the Office of Diversity and Outreach and understanding we needed to work more closely with community colleges and get more students from underrepresented backgrounds into our program, the last few cohorts, we're now up to 80% students from underrepresented backgrounds. So this is, as I say, I think a demonstration project that's on the verge of really being able to scale. And I'll talk more about that in a minute. But the key transformation of an internship is to, as we're moving, as we're adopting this health professions trainee model, is we need to stop thinking about internships as only like summer internships. Those are valuable. Brief exposure and orientation and everything can be super valuable in the summer. But this model of an internship is that it's year-round, because our navigator teams, they need the capacity 24/7, 365 days a year. And it's not just one-time internships for 1 year, it's multi-year internships. And that way we can grow people with their entrustable activities up a career ladder. It needs to not be volunteer, as internships have been for many years in many places. This needs to be for academic credit and paid. They need to not be rare. The opportunity here is healthcare navigation is a big task for the healthcare system. We should have abundant opportunities for internships in the area of healthcare navigation. They need to not be privileged. Many people get internships because their parents are doctors or are in the healthcare system, or relatives or friends or their social network gives them access. We need to invite students in and build a systematic funnel to get students who just have an interest in healthcare from whatever background they are, and make these internships accessible. And as I mentioned, this is not about shadowing. This is about giving people entrustable activities. And these internships need not to be scattered and sort of hard to find, and like you need a lot of interfaces to pursue internships. We need to have some centralized, as I said, systematic funnels. So this is a picture, and this is my last slide for now, but this is a picture of, what centralization looks like for internship opportunities. I used to think that the Patient Support Corps might be a model that we would clone, and we would have chapters and franchises in every educational institution and every hospital, et cetera. And my thinking has evolved to more of a hub and spokes model. And actually, our work with the VA created this kind of demonstration, because what we blazed as a trail there is to say, UCSF and the UC system in general has affiliation agreements with every healthcare delivery system. We send medical students, residents, fellows, we send them into the VA, the SF County Hospital, the Kaiser, everywhere, Sutter, everywhere. So we already have the risk management, the legal framework to bring people into those environments. So why not bring, instead of medical students, let's bring undergrads. So we did that, and so I think we were the first to sign an agreement with the Veterans Health Administration where undergrads have come in and been badged and given access to the electronic health record as health professions trainees, not as volunteers. The typical path, if you're an undergrad into the Veterans Health Administration, is to be a volunteer. That's a designation where you're basically shadowing and maybe helping with some really not super healthcare intensive tasks. But with an affiliation agreement with the designation as a health professions trainee, you're now able, as a undergrad, to do something very responsible. So we can leverage the University of California's affiliation agreements. We should have one hub with interns coming from all over the state of California. We can do these internships as telehealth internships for the most part. And so we should have one hub where people come in to our system as UCSF student interns. That's a job classification. And then we sign service level agreements and contracts with the clinics that serve as placement sites. And we have a lot of expertise in getting students ready with job readiness training, working with our educational institution partners around orienting them to careers, and then deploying them into these clinics with on-the-job training and supervision and so forth. So to give you I've given you the conceptual ideas behind where our program is going. And so now to make this a little more concrete and bring it back to what's happening on the ground, I'd like to invite to the stage our panelists, and they represent the clinical champions who have been the early adopters of this model. So Gina, if you would come from the Office of Population Health, and our panelists will introduce themselves, but as they're making their way up here, I'll tell you some stories about how we met. Chris, if you would come up, and Katie, Kathleen Sarmiento, Dr. Sarmiento, if you would come up. As I mentioned, our program existed previously in a kind of a smaller scale. And when COVID hit, I emailed Josh Adler, who's the chief clinical officer at UCSF, and I said, I've got a lot of students who really want to help and can be trained to do so. What can we do to help with the COVID response? And Josh put me in touch with Gina. This was early 2020, early days of the COVID pandemic. And I have to give Gina just so much credit as a leader, because Josh said, well, Gina's really leading, the Office of Population Health is really leading our COVID response. And if you can imagine how hectic life was for the COVID response team at that time, layering an innovation onto that work, most people would have said, no way, my plate is full. And Gina really had the vision to say, yeah, actually, this could help and we can do this. So I'm really grateful, because I think, it turned into a great success, and we had a commendation from the dean and commendations from the health system ultimately. But going into it, it was really a tricky time for everyone. And then likewise with Chris, I had emailed Chris. We had done a small program with the liver transplant, and I emailed Chris and said, do you want to expand? Is there anything else we could do? And I didn't really hear back, and I figured, okay, maybe that didn't go so well or whatever. And a year later, Chris digs this email out of his inbox, and he says, hey, yeah, we're starting to innovate with kidney transplantation. Why don't we talk and set something up? So I have to give you a lot of credit, Chris, for remembering that we were doing this and pulling that email out of your inbox and following up. And then similarly with Katie, I met Katie through my colleague Mary Woolley in the Institute for Health Policy Studies. And I came in as a program designer and evaluator to help with the sleep program. And Katie is such a visionary leader, was so curious about the work we were doing here at UCSF with our workforce innovation, and quickly said, hey, we need to do more of this kind of thing in the VA as well. So as we go through, I think I'd like to go in that order chronologically, really, how we expanded. And so Gina, if you would reintroduce yourself in terms of your position, et cetera, but that's how we met. Take it away.
Is this on? Yep. So Ian, be sure to give me the 1 minute because I can talk a lot. So hi, everybody. I'm really excited to be here. And so I learned so much today, Jeff, about the program that I didn't know. And I think this program is amazing. So as Jeff said, we met during the pandemic. And as many of you know, the pandemic really uncovered healthcare disparities that had always been there, but we never really paid attention to. And so when Jeff offered that we could have really smart, passionate people come work on my team, I said yes, and my team embraced it as well. And so just to give you a little background of the Office of Population Health, in case you don't know what that is, not a lot of, it's rather a new entity within healthcare systems. But as we move into payment reform in healthcare, there is an opportunity for health systems to think about how they deliver care differently, which is really focusing on wellness, prevention, outreach and engagement to patients in their communities and at home. We've set up a system where patients typically come to us and come see us for very acute services and some wellness services, but we haven't really invested in the infrastructure to help patients manage their complex and chronic disease at home, remind them of their wellness and preventive activities. So our office is partnered very closely with our primary care clinics. And so to put it in perspective, we have about 130,000 patients across our primary care clinics. And every single one of those patients typically needs something, a mammogram, a cervical cancer screening, depression screening. And as many of you know, depression is a crisis for our populations right now. And so what we did was we really, and I'm a nurse by background. I have my master's and PhD in health policy. This is a perfect job for me. I love my job. But I also really believe in that we need to get to our healthcare delivery workforce matching the populations that we serve so that we have language and cultural concordance and we can deliver better care. And this particular program gets us on that pathway to do that. And I was so excited to see the number of the graduates that went on to become nurses and doctors and pharmacists, because this is what we need. Anyway, so the students came to, and why we have so many of them is because I was a nurse for a long time, and I found myself doing, and nurses, as you may know, especially at UCSF, are highly skilled but also highly paid. And that's a good thing. But sometimes the tasks that we were giving nurses, and I'm testimonial to it, did not require the skill set that I had. And wouldn't it make sense that we put the nurses' skills where they're needed? But what was that missing link was what we would call the non-licensed healthcare navigator. And as Jeff said, that encompasses a lot of key tasks that patients need, but you don't want to be paying a nurse to do that. And so we embraced the navigators, and I embraced that early on. I was one of the first people to have non-licensed navigators in the health system because I knew that smart, passionate people who could be trained in very particular workflows could do that work. And in fact, oftentimes connected better with the patients because there wasn't a power differential of being a healthcare provider. So we set up the program and really excited. I think we're going into our 4th year now, and the students are very mature. And as Jeff said, they have almost like a career ladder. They're able to take on more and more tasks, and some of them are doing behavioral health outreach, cancer screening outreach. We manage a Medicare Advantage population, which is many of our frail seniors, helping them coordinate care, helping them get to where they need to be. So. And what I will say about this program is the kind of skill sets that they are learning from this will serve them no matter what healthcare field they go into. And we would welcome them as navigators in our system as well, because that is a wonderful role as well. So just wanted to say how wonderful this program is, and I really believe in it, and I'm always trying to think of ways to expand it, and I'm hopefully helping Jeff do that. So thank you very much. Oh, sorry.
All right, well, thank you, Jeff, for inviting me to talk about our experience in the transplant world. My name is Chris Fries. I'm an abdominal transplant surgeon, also the chief of the abdominal transplant program here at UCSF. And I don't usually dig in my old email box, but I'm glad I did, because Jeff and his team have really addressed a major problem that we had in kidney transplantation. And I just want to give you a little background of what the problem was, and I think the innovative and novel solution that we are currently working with. So kidney transplant, as you all know, is a wonderful therapy for patients with end-stage renal disease. Our program is extremely popular. We have the longest, biggest list in the country, with nearly 4,300 patients waiting for kidney transplants. And as I'm sure you all know, there's an incredible shortage of donor organs, and so our patients wait a long time. The Bay Area is very popular in terms of transplant programs, and the wait for a kidney in the Bay Area from a deceased donor is upwards of 8 to 10 years, depending on your blood type. So living kidney donation is a way around having to wait that 8 to 10 years, which of course is accompanied by a lot of morbidity and mortality if you don't get your transplant in a quick enough fashion. Our program does anywhere between 120 and 150 living donor kidney transplants, and then close to 300 deceased donor kidney transplants. Despite many efforts over the years to increase that ratio of living donor kidney transplants, we really haven't been able to move that needle. And when you think about the process and how this all works, a patient first comes into our system for an initial evaluation, which is generally a half-hour to 45-minute meeting with a physician or a surgeon, meeting with our nurses, and they hear all about all the intricacies of kidney transplantation, which are, as you can imagine, quite complex when you start talking about the immunosuppression and the complications of the surgery. So, patients, I think, are clearly overwhelmed when they first receive all that information. And most times buried, I think, in that information session is the message about the importance of considering living donor kidney transplantation. And in the past, before the work that Jeff's team has started doing with us, we would have that initial meeting, and that would be it. The patient's sent off to go back to their dialysis, and we may not see them for 6 or 7 years until they're getting closer to the top of the list, and we're then doing their testing. So an opportunity is lost to really interface with the patients and remind them on at least a second visit of how important it is to consider living donation. And that's where I think the Patient Support Corps really added a new dimension to address this problem. The program is called REPEAT, which stands for Realizing Patient Equity in Access to Transplant. Jeff, thank you for figuring out the R in that acronym. But what this program is a collaborative effort with the Patient Support Corps, and the way we designed it after a lot of iterations and discussions, and by the way, thank you to Allison Weber, one of our nephrologists who was instrumental in this program, and also Anna Mello, who I'm not sure is here. But in any event, one of the advantages, if there were any of COVID, was the rapid adoption of telehealth. So we now have Zoom visits when we first see our patients, so we have the opportunity for student interns to sit in on those visits. And they participate in the visits, they hear the nephrologist or the evaluating physician talk to the patient about all that is involved in transplant, and that interaction is actually recorded and then transcribed. And the interns then kick into action within 2 or 3 weeks after that visit to again connect with the recipient, review that transcript, and say, hey, do you remember the physician saying how important living donation is? Do you have any thoughts about living donation? And a new level of interaction is going to be the interns can tell the potential recipients who are interested in living donation a way to set up a website so they can use that as a tool to then ask potential donors without having to directly go and ask them. They can give them a business card and say, hey, here's my story on a website, check it out, and if the donor has some interest in that, that may be a way that a donor would come forward. So you can imagine in recipients who have issues with health literacy, who don't speak English, these paths through this long journey to transplant are incredibly difficult. A road full of potholes and horrible signage, and it's long. And the interns have really helped to, make that initial adventure on the road, I think, a little bit smoother and hopefully provide information that's very helpful for our patients. So we're very excited to continue this. I think it's been a great success today, and I want to thank Jeff and his team for the collaborative effort. It's really been a great experience for all of us involved on the transplant side.
Hi, everyone. I'm Katie Sarmiento. I'll just introduce myself briefly. I'm a pulmonary sleep physician. I'm a professor here at UCSF, but I live and breathe the Veterans Administration. I wear two hats there. One is as a national executive director, where I have more impact on policy and how we deliver care. And then my other job, which is where Jeff and I also overlap, is as part of a regional care team that was started 3 years ago with the goal to go out to different facilities and provide care where there were gaps in providers in sleep medicine specifically. And so we've built out a 25-person team that's entirely telehealth-based, and we cross state lines. We leverage the federal network and infrastructure to really get care to where patients want it and when they need it. And I'm really quite passionate about innovating in healthcare, a little crazy sometimes, and Jeff reminds me of that periodically. But I had a real aha moment when Jeff and I were chatting one day about workforce woes in the federal system and hiring freezes and budget cuts, and thinking about some of the complexities of managing purely virtual teams and having people be able to practice at the top of their license, and how to really structure the workload and the patient care pathways in a way that made the most sense for the clinicians, but also provided the best outcomes for the patients, who are our primary stakeholder. One of the things, well, first of all, I want to say I echo everything that Gina has said about your comments for the program, and I can only hope that a year from now I'll be providing some feedback on how this program is working in VA. Because Friday, they literally got their badges, yay, about 3 months faster than we thought it would happen. But we haven't actually launched any of the activities yet. So hoping for an update next year. But the aha moment was really about bringing people in through the patient support core program and partnering them with different members of our team. We've settled on embedding them with our RN team first, because we had brought in a whole cadre of RNs to really become those patient care navigators for veterans across facilities in these different geographic areas, and to help them understand how to make the right decisions about their care, to do assessments about access to broadband, electricity, how they prefer to engage with providers about their care, to educate them, like really teach them about how to effectively engage in shared decision-making about their treatment planning. And that's really my vision, is to build out a healthcare delivery system that is more patient and provider balanced rather than more provider-centric in the historical way, and recommending therapies and kind of being a hammer and nail. And I think this opportunity is really wonderful, really enthusiastic, and I can't wait to open the floodgate through San Francisco or another VA facility in California and leverage the infrastructure we have through telehealth programs to really scale this up once we do this pilot for the next year. So I'm looking forward to learning from the experiences of my colleagues here, so that we can provide the best experience possible.
Awesome. I love hearing the phrase "open the floodgates." That really gets me very excited. So we want to turn it over to you for questions and comments. So you have all these different perspectives. We have, you're from healthcare systems, from educational institutions, from the policy arena. Please, do we have a mic? Ian has a mic. Raise your hand. Don't be shy. I don't think this is a shy audience. So raise your hand, and Ian will. Go ahead.
Do you want to kick us off with a question, Jeff?
No, I want to see first. Yeah, let's see if anybody has one, and then look, as the moderator, I can jump in with questions for sure. But who has a question? Who wants to make a comment? Yeah, please.
Hi, my question, first of all, my name's Puneet. I'm here on behalf of the VA NorCal healthcare system. So my question's kind of to both Gina and Dr. Sarmiento, if either of you would care to elaborate. How did you, set up this program in relation to the RN teams? What's the function there kind of like?
Yeah, I can comment that because we already had navigators, we have the navigators working directly with our navigators. So they're a whole team unto themselves. They're a whole peer group unto themselves. And so they've been training the navigators. They have escalation pathways to the nurses, but the nurses were not training the navigators.
Okay, so the nurses themselves are not doing personal training with the unlicensed navigators.
Well, we have a nurse manager who oversees the whole team, but this is navigator work, and we had and we're mature in the navigator work, so we had very well articulated workflows and escalation pathways. So, for example, and I think it's brilliant because nurses do not need to nurses do assessments, but navigators can ask the questions. What they can't do is analyze sort of an outcome from that. That requires a licensed person, but they can certainly gather all the data and have those conversations and help clarify questions and things like that.
Okay, thank you.
Hi, thanks so much for being here, guys. Thea Sakata, I am an alum of the Patient Support Corps, of what became the Patient Support Corps, but I'm asking today, as a clinician, so at Intermountain Health, we're setting up a integrated practice unit around Parkinson's care. So an integrated practice unit is basically a clinic that has, it's sort of a patient-centered medical home around a specific disease, for those who aren't familiar with the term. I am a primary care physician, family med trained. I'm working with the neurology team as well as other allied care providers. Excuse me, I'm forgetting my terms. I think my question is mostly for Chris and maybe Katie. When engaging with the Patient Support Corps, can you tell me where you felt like there was the most friction in that whole process and getting something up and running?
Well, I don't think there was a lot of friction. I think one of the important goals of our early meetings was getting Jeff to sort of understand what our problems were and what the guardrails were in terms of what we could do in terms of interfacing with donors and recipients, because there are some regulations around that. Jeff is wonderful in thinking of very innovative and aggressive ways to address some of the problems we had, at least. I had to rein him in just a little bit and say, well, we can't go, interrogating potential donors. We have to work through the recipients. So, but he was very understanding after a few emails, and came up with a plan that not only allows for us to behave within the guidelines that were assigned, but also I think integrated our team very well, and of course allowed his team to get the proper education to ask the right questions during these interviews. So really there wasn't a lot of friction is the bottom line. He was great to work with.
I'll definitely second that. I think the biggest challenge I feared was going to be long delays hiring into the VA system or onboarding people into the VA system. And Jeff was tenacious about staying on top of these emails and forcing people to very methodically lay out exactly what needed to be done and then corralling people back to that checklist of making sure that things were going to be happening in a timely fashion. But as Jeff alluded to earlier, I think the real pivotal point was having the participants categorized as pre-health trainees. And that is a game changer for what they can and can't do to support the clinical teams. So
It's actually health professions trainees.
Health profession
So we're
trainees,
kind of
sorry.
upgrading them. Like they're not just pre-health or volunteers,
Thank you.
they're actually health professions trainees.
Can I just make one comment, because I think this comes to operations? I would have said no to Jeff if he hadn't offered and done the thing that would have been really difficult in friction, training them on the EHR. So Jeff takes that as part of that. Also training all of the navigators in motivational interviewing. So I think as you enter these programs, and the Office of Population Health actually supports some of the administrative costs for the program, but if I had asked my teams to take that on, there would have been a lot of friction. So just recognize as you start these programs that, you know, there may need to be some administrative support and also managing the interns if there are performance or issues. So it takes that part of it out of that would have been a hard sell for my team. And so I think we came to the perfect match of our skill sets and responsibilities.
I'll add to sort of answer your question about VA and the RNs, that's the role in large part that the RN team, it's why we're starting them off with our RNs, is to help them navigate all of the different systems that are involved on the VA side that they're not going to have experienced previously. And our RNs not only play the role of helping patients navigate the system, they're not true navigators, but they're the care coordinators and the point for patients in our program, but they also have the time and the bandwidth to provide that mentorship and education and training to the interns. So.
And what I think they see, the RNs and VA see as what's in it for them,
Yes.
is the famous quote that they had was, they said, you know, we're turning into survey people. And I think they respect survey people, but they don't want to be survey people. And what they mean by that is administering a health risk assessment or administering some of the required, you know, surveys that need to be part of the intake. You know, veterans like all of us are, you know, busy people and have other things to do, and so they don't always fill out these surveys. But having an intern who can call them and say, let me just talk you through this and I'll record the answers, that's a benefit for the nursing team, that they don't have to do that, because it's absolutely required that they get that information, you know, as you know. So other questions, please, these are great, keep them coming.
I don't have a question, but having worked with this program, I can make a comment also about the friction question.
So this is Allison. Thank you for
Allison
being
Weber,
our
sorry.
champion.
Yes.
You're the best.
I'm one of the transplant nephrologists, and I've been working for a year and a half with the interns. And I would say the only other issue was that there is a little time involved in this. So the way it works with our program is that mainly the nephrologists are the ones doing these evaluation appointments with the interns on as well. And so it does take a little time to you know, get them set up, and we give them a little time to give their spiel, what their role is going to be. And so if you have, if you're under pressure for time, that would be a little bit of some friction. However, the benefit, and all of our nephrologists are on board with it, is the help that they give to our patients, the fact that all the information we've given is now documented for these patients, they can review it, the benefit of them being able to have another contact, a person that joins the team that can be oftentimes, they've actually helped our patients with Zoom a lot of the time. So the patients can't get onto Zoom, and I see the intern is working with the patient and getting the patient onto Zoom. So there's definitely, the friction I would say is some early on we're a little bit resistant because of concerns of time, but the benefits outweighed that in terms of the help that they give to our patients. And so that's been our experience as well.
Yeah, that's a good example, helping with Zoom, being a digital health coach to help bridge the digital health divide. One of these very entrustable activities, you can entrust that activity. In fact, there's nobody better than a college student. Let's be real.
Hi, I'm Barbara with the San Francisco General Cancer Navigation Team and with my team of navigators here.
Welcome.
And thank you. And the question I had, I guess especially to Kathleen, it takes us almost a year to hire for a vacant position. So I just wondered, as an outside institution, what was the time length it took to actually get the students on board?
My memory is terrible these days. In my head, Jeff, I feel like this happened 4 times faster than the average clinician hire. 6 months-ish from...
Well, I'm deeply frustrated because this took 4 months. And
I've already multiplied VA timetables. It was
no, and it drove me crazy, and I think we can do it in 2 months. So, you know, Katie, we have this bet where Katie was like, yeah, this will take 6 to 12 months. And I was like, no,
wanted to set
we're going to do it
realistic expectations.
we're going to do it in 2 months. So we kind of split the difference, but it's, I think we can be faster the second time around. And once we have a relationship, this kind of thing, we now know what we didn't know previously. Now, one thing I'll mention is that, so we hire the students here at UCSF and we place them as employees without compensation as health professions trainees. So they don't go through the HR process really at VA. They're brought in through this health professions trainee designation. That's a huge benefit. The friction that we avoided, even though there was still some getting them the PIV card and, you know, all that kind of thing was still some friction. We didn't, you know, at UCSF, I can fill out one form and appoint a student to be a student intern as long as they're enrolled in an educational institution and they agree to work less than 20 hours a week, and they're going to get wages and not benefits. That's a educational position that I can bring people into, and that's another huge benefit of this whole program. There's no delay in hiring. Thank you.
Hi, I've got a comment, Ann Schnur, Director of Career Success for 10,000 Degrees. We have some students who have been through the program since the early days, so thank you, Jeff, for really launching this. And one thing I was thinking about recently is that we work with college students all throughout the Bay and beyond, and I was recently looking at all of our college students who are over 4,000 college students at 100 plus colleges and universities, and one of the top career fields of interest is healthcare. And so, of course, my colleague and I and others who work in our career services often think about the opportunities needed to help students launch those careers. And it is limited for undergraduate students and even more so for community college students. And so I just wanted to thank Jeff and others, everyone here who has hosted the interns in your departments, CCSF who have been partners in this process. It is a hugely important a meaningful engagement internship opportunity for the students. We know that it's had a large impact and has helped launch the careers. And it was so exciting seeing that statistic today that about 75% or so have gone on to careers in the field. So it's truly a win-win partnership, and we're just really grateful for everyone who makes this happen for not only 10,000 Degree students, but other students as well. So thank you.
Yeah, we appreciate your support as well. And we have 50 students now. We think we have the infrastructure and can scale this. We can have 500 students in a few years. We can have 5,000 students a few years beyond that. There's no reason why we wouldn't have 50,000 students doing this around California, maybe around the country. So I think there's that kind of need in the healthcare system for navigation. And this model, I think, can just provide the capacity that the healthcare system needs. So I hope you'll continue to help us breaking that open. I think we have time for maybe another question. And by the way, please also feel free to ask questions of the students. We have 6 students here. Alondra, you've already met. Where's Alondra? Yeah, so we'll get a mic to Alondra or any of the other students if you want to ask her anything or ask them anything.
Yeah.
Josh? Yeah.
Josh Martin. I work with the Cancer Center and help with the SCNS project that was a slide. Actually, just more of a comment that one of the things that's been really beneficial about the intern teams is, as we're constantly working on program refinement and design, is leaning on their perspective and their insight, because they're closest to the cutting edge education. So my education was a while ago. Having sort of intellectual partners in developing how the program continues to roll out has been really valuable. I'm only limited to my own thoughts, so having access to theirs has been really wonderful.
Great. You've been a great partner. Thank you.
I have a question for the students, or anyone who wants to answer. What has been your most valuable, what is your most valuable takeaway of this experience thus far?
Maybe I can point that to Cindy, since you work in Gina's organization. Thank you, Cindy.
So, can you please repeat the question for me?
What has been the most valuable part of this experience that you've had?
Okay, so my name is Cindy. I work with the behavioral health team under Gina. I believe the most valuable experience is just being able to interact with patients. Before PSC, I haven't had the chance, and being able to help them look through resources. So I send therapy and psychiatry resources. So being able to offer them these resources, walk them through what to do, and just also outreach to clinics to find resources for these patients have been an amazing opportunity. And I appreciate Jeff so much for this opportunity.
Any other students want to answer?
To answer your question, I feel like when I was thinking of that question, there was two aspects of it. Like one aspect being the professional and personal growth from the skills that I've gained through my experience. And that goes from public speaking. I didn't ever think I would speak up here in public. Communication, knowing how to communicate with patients, knowing how to effectively manage my time, and little things like the importance of responding to emails. So there's that aspect, and there's also the one-on-one patient interaction aspect. Recently, I was working with Dr. Weber, and the patient was a Spanish-speaking patient. And during the spiel of the appointment, I was speaking to the patient in Spanish, not needing the translator. And after the appointment, Dr. Weber told me that you could just see the smile light up on the patient's face after knowing that one of their health advocates speaks Spanish. And just those interactions, knowing that we're able to provide these services, these culturally competent services to patients, has been one of the most valuable parts.
Well, Thea wants another bite at the apple.
I want another bite at the
Go ahead.
Do you want a 15-year alumni perspective? Yeah. So definitely the communication piece. I was telling Jeff before this symposium started that the experience that I had in the patient support corps was basically better than any medical school communications course I had in medical school. The fact that I could speak to patients already was just so valuable going into any health profession school. That alone would be great. But in addition to that, I would say it got me thinking very early on about healthcare systems as systems, and what potholes were the patients that I was working with, what potholes were they falling into? And from that, I kind of have carried with me through my education, training, and into being an attending, looking at, number one, where do I want to practice? Like, what healthcare systems out there are thinking about systems? So that's how I ended up in Utah. I'm a Northern California girl, born and raised, but now live in Salt Lake City, Utah, working for Intermountain Health, because they're one of the systems I found out there that sort of thinks about these things. But also kind of really recognizing the importance of taking each individual patient journey for what it is. I think without participating in this program, I don't think I would have recognized the fullness of that.
All right, well, listen, in the interest of time, and because we want to capture all of your voices, I'd like to thank the panel and then have you fill out a survey. So we're going to distribute the surveys, and don't worry, we're also going to pick up the rest of the program, but I wanted to take a little pause and have you reflect in writing. We know the importance of writing and critical reflection, and also not everyone wants to speak up and get a microphone and everything. We want everyone to have a voice. So the surveys are coming around. While they're coming around, could we give our panel a big round of applause? I can't tell you how fortunate I feel that we got all three of them at the same time. They're some of the busiest, hardest to schedule people around, and they were just so generous to come and share this time with us. So thank you all. You're excused to your spots. Please fill out a survey too. And now as you're getting the survey, we're coming around with pens and paper. I had to ask my wife about this. I was like, hey, you know, I'm doing the symposium. She's a 7th grade teacher. I was like, how do I get people to sit still for 5 minutes and fill out a survey? Because, you know, it's going to be like halfway through the program. And she said, okay, well, set a timer and tell them not to bother their neighbor if they have a question. If you have a question, raise your hand and I will come and answer your question. Do not bother your neighbor. Now, one thing I want to say about, sorry, Ian. Oh yeah, okay. Your reward after you've finished the survey is you'll be able to go get dessert at the back table. So let me just explain one more thing about the survey, which is that at the very top, I invite you to fill out your contact information. Now, if you fill out your contact information, you are opting in. We will always communicate with you via the registration list, but that will be one-on-one communication. If you fill out you can fill this out anonymously, so feel free to fill it out anonymously. If you put your name and contact information, that will be your permission to me to include you in group emails, sharing the results of the survey, following up with you in other ways, and continuing the conversation. So if you'd like to be part of the sort of brainstorming and moving forward, please fill out your name and email address especially. And if you want to just be anonymous, that's totally fine. We welcome your anonymous responses as well. So I'm starting the timer. Nobody gets dessert for 4 minutes. Okay. Thank you, everyone. I'm going to be able to report to my wife, Amy, how wonderful this audience was in terms of filling out the surveys. So if you would now please rejoin your seats at the table. The desserts will remain there after the event. So we're going to conclude at 2 sharp, but we will keep the desserts out. We're going to now hear from a recent alum. So Thea, if I can have you resume your seat, please. I'm calling you all out. No, desserts out. You get it afterwards. Yeah, that's life. All right. I just want to really respect Safi's time at the podium. Safi is a post-bac intern. So we have a program in the Breast Care Center where students who've completed their undergraduate degrees sometimes need a little extra time to prepare their applications, take MCATs, that sort of thing, or other admissions and exams. And so it's very common for people to take what they call gap years. And so we at the Breast Care Center, through Laura Esserman's leadership, have an incredible post-bac program where they continue some of the work they did with the Patient Support Corps for about a day a week. And then the rest of the time, they're doing other full-time employee tasks for the Breast Care Center. So I wanted you to hear from Safi because she's just been through the process of taking all her experience in the Patient Support Corps and other places and submitting an application, or many applications, to medical school. So please welcome Safi.
Great, thanks Jeff for that introduction. So hi everyone, my name is Safanat, but I also go by Safi. And I'd like to start with a quick background. So my family and I, we immigrated to the States back in 2016. So I was 14 years old when I landed in Los Angeles. My parents, they struggled to find jobs in the very beginning because they did not have the college degrees. So my dad, he started working as an Uber driver full-time, and then my mom, she started working at a daycare, and they both continue their jobs to this day. But these were relatively low-income jobs, and they did not come with health insurance. So when we got here, that was one of the first things we realized, that healthcare in the States is quite expensive. So we tried our best to avoid going to the doctors until one day when I got sick with a cough, and that resulted in the single ER visit and hundreds of dollars that my parents had to pay out of pocket because they did not have health insurance. So my parents, they were going through their own struggles just in their jobs and trying to build a home in a new country. So in high school, I had learned about something called Medi-Cal, and I, as a kid who was fairly proficient in English and also good with technology, I was able to walk my parents through like the eligibility and the application process for eventually obtaining Medi-Cal. But that was really when I realized the importance of advocacy in healthcare, not just for my own parents, but also for the many immigrant families in California who probably go through different versions of this same story every day. So in high school, I studied very hard because I knew I wanted to contribute to my family. Fortunately, got accepted to UC Berkeley and got very generous financial aid. But when I got to Berkeley with this idea that I wanted to pursue healthcare, I had no idea where to start. That was the hard part. From early on in freshman year, I would hear pre-meds talk about the classes that they have planned for the next 4 years, the grades that they will hopefully get, the research, the publications somehow, the clinical experience. And this was everything that I personally had no guidance for. So, unlike others, I came from a first-gen immigrant background with no family or acquaintances in healthcare. So I started sending cold emails, and I sent a total of 42 emails that first semester of freshman year just to, shadow doctors. And these were people in the East Bay in the San Francisco area where they had their clinics. And I received responses from I received responses from 6 of them, and I received silence from the remaining 36. Most responses were just, we're currently not accepting any shadowing requests. So the following semester was when I applied to the patient support course. So this was an opportunity that Jeff had posted at UC Berkeley. And that semester, I was one of the 22 applicants, one of the 3 who got accepted, and I was really hoping that I'd get some shadowing through the PSC. But fortunately, to my surprise, the PSC offered much more than just shadowing. As we heard from the panelists, as an intern, I wasn't just watching nurses, social workers, physicians, and navigators do the jobs that they do, but I was actually actively working with them as a workforce extender, as a patient scribe, as a healthcare navigator. So right now, I am in the middle of my medical school cycle. Having been in the PSC for about 4 years, my experiences have really become the basis for my applications and my interviews. My freshman year old self would not have imagined how far I have come in this pre-medical journey, especially since it's hard to even get interviews. For anyone who's been through the cycle, you may know. And I've been fortunate enough to get a total of 5, including from institutions like UCSF, Johns Hopkins, Dartmouth, Loyola, and Charles Drew. So thank you, Jeff, and thank you to the PSC. But again, even in these interviews, I've been able to draw upon my experiences of being a healthcare navigator, of how I guided patients during the pandemic, of how I fielded questions from over 500 patients about COVID testing and vaccines, but a lot of them were just like my parents. They were confused, they were fearful. So yeah, just being able to navigate healthcare with them, and most importantly, learning how to advocate for people beyond my family. That's one of my main takeaways as an alum from the PSC. And without the mentors and my fellow interns that I met in the PSC, I don't think I would have learned the patient care skills and visions that I have today. So hopefully I'll be pursuing my next chapter as a medical student soon, but really grateful for how far I have come through the PSC. Thank you.
Thank you, Safi. That's, again, seeing students go through this process and come out the other end, and we're just very optimistic for your success in your next chapters. And so with that, actually, I think Safi's story really illustrates some of the dynamics that when I met with the Office of Diversity and Outreach, where they said, hey, look, it's great that you're working with Berkeley students. We really need to get community college students in, because so many of them reflect the story Safi just told, reflect the stories Alondra told. And that's where actually most students are like that, right, in the community college system. So we've been working with Don Daves Rougeau, and he's going to provide a perspective on how do community colleges, what is their vision for collaborating with workforce development and preparing students and connecting them with this kind of opportunity. So we're very excited to have Dawn here. Please come up, Dawn, and make your, teach us about the Vision 2030 in the community college world.
Well, good afternoon, everyone. First of all, I want to thank Jeff for his leadership in all this work, and you're absolutely right about his task mastery around making sure that every aspect of the work was followed up on very diligently and in a timely fashion, and greatly appreciated for folks like myself who can get distracted by 1,001 things. So his one was always at the top. So I appreciate that. Once again, my name is Don Dave Rougeau. I'm the new senior advisor to the chancellor at the statewide community college chancellor at the community college system. And I work on strategic partnerships, workforce and economic development, a little bit of AI thrown in just for fun, because I mean, who's not working on AI right now, right? So I also want to introduce one of our vice chancellors, Rebecca Ruan O'Shaughnessy. She's the vice chancellor over educational services and supports. So she will also be deeply connected in this work. We have another vice chancellor, Anthony Cordova, who is the head of workforce development. So he's also will be leading a lot of these efforts with the community colleges statewide. Part of my journey here, I think it's important and instructive to share, is that in my previous role, I worked at the Bay Area Community College Consortia, and we support 28 of the community colleges across the Bay region. We've got John over here, who's part at CCSF. He's one of our partners who's been really essential in this work. And then we've got a few others, Jeff and Araceli and Karen, who's at SFUSD. It's a massive infrastructure across the region, and it's one of 8 regions across the state that is supporting workforce development. Vision 2030, I think, is much broader than that, though. Just want to make sure we're not solely focused on workforce development. So Chancellor Christian, her mantra is the time is now. And that is to say we are moving fast and quickly in a broad-based effort to bring in partners, strategic partners and collaborators to drive this work with intentionality around supporting the most minoritized and marginalized communities across our state who typically have not had pathways to this work. So next slide, please. One more. Wait. Okay, there we go. All right. So one of the primary, at the core of the Vision 2030 is meeting the needs of today and the opportunities of tomorrow. So Vision 2030, we're focused on strengthening our systems and using those systems to get students in and through our colleges and faster and in a more equitable fashion. We know that our student body is changing. It's no longer like the student body that I was as a young person, or as an educator, as a teacher, even as a university administrator and faculty, just not that many years ago. There's a changing landscape in this work as well. The communities that we're trying to serve really need a skilled workforce. The economy of California, the economy of our nation really needs to have that skilled workforce. And what's really particularly important about this is that we are laser focused on serving those communities that our systems have not served in the past. And we're focused on making sure that the systems bring the supports to the students and not expect that the students find those supports on their own. And so that's really a flipping and disrupting of that structural system to make sure that our students are and adult learners are providing the success and resources that they need. Next slide, please. So this is just a slide that really kind of helps you bring into focus the scope of the types of communities that, the diversity of communities that we're focused on. So bringing college to all of these students. So to our veterans, there was some discussion earlier today about mental health for veterans, working adults, or future leaders. We use dual enrollment as a strategy. So we are trying to encourage high school students to finish their high school studies with 12 college credits through dual enrollment to ensure that they are on path to post-secondary success. Foster youth is another area of particular concern for us. and the students who are justice involved or justice impact. We have, I think, 36 campuses around the state thereabouts who have a Rising Scholars program that's specifically focused on working with those who are justice involved while they're incarcerated, and then putting them on path to success once they come back into the larger society, and we want to make sure that we reduce that recidivism. Next slide, please. So how we know we're getting there, these are our goals and metrics. 3 areas, 3 large buckets: equity and success. We want to increase with equity the number of California community college students who are completing a meaningful educational outcome, who obtain a baccalaureate degree, and who earn a living wage. And a meaningful, equitable outcome doesn't just have to be a bachelor's degree. It could be a certification or a credential that leads them on path towards a bachelor's degree or into a high-wage, high-demand job. And internships, paid internships, apprenticeships, pre-apprenticeships, all of those things are really essential to putting those learners onto path for economic success. We're super excited to have a strong partnership with the Labor and Workforce Development Agency, and our deputy director over here, Abby Snee, is part of that work and a strong partner in that work with us as well. Equity and access, so we want to increase the equity of the number of students who are attending a California community college. I think we're at 2 million, so the largest higher ed, public higher ed, well, just the largest educational system in the world, right? 2 million students. Right? So we're super focused on making sure that not only do the students have access to higher ed and post-secondary opportunities, but that they are completing those opportunities, and we're making sure we provide that equity and support to give them the wraparound services, the social emotional support that they need, the basic needs that they may need, housing, childcare, all those types of services that we typically don't take into account when we're trying to move the most marginalized communities towards success. Next slide, please. And these are the 3 big areas that I mentioned earlier. So equitable pathways to baccalaureate attainment. We are committed to the governor's ambition at a higher education goal of 70% post-secondary degree and certificate attainment among working age Californians by 2030. The next bucket is the equitable workforce and economic development. So this is the area of work where we focus on making sure that we build partnerships between the community colleges and our industry sectors, as well as our community-based organizations, to provide that kinds of hands-on training for career readiness. And these are our 4 sectors that are our areas of focus. These come from the governor's Recovery with Equity report. I think it's been about 4 or 5 years. I think it was released right at the early years of COVID. But this is his principal focus on these areas. So healthcare, climate, STEM and technology, education, and early education pathways. So, and I think we can look at this program, which is incredibly successful, and understand how early childhood education is a healthcare issue, right? Ensuring that we provide that type of support to families and communities provides that overall wellness, health, and then also who's going to be training are we able to provide the level of teachers and faculty in these programs going down the line that are allowing us to be able to provide the instruction and the educational opportunities that are necessary. We have a huge crisis and shortage of faculty and teachers at all levels. So as we continue this, we want to encourage some of these interns who are going to go into the practitioner side to also maybe think about becoming faculty in your institutions. And then the third piece, of course, is the future of teaching and learning, generative AI. We're all probably using it at some point, even as we are in the midst of this exercise today, the symposium. Jeff, I certainly was thinking we're going to do an online AI survey, but we got to have some room for improvement for the next one, right? Yeah. So next slide, please. And then Vision 2030 in action. So it's one thing to have this big, comprehensive strategic vision. How do we actualize this? And so these are just 4 areas that we have focused on, and I'll get into a few others in a moment as I talk through this slide. But apprenticeship pathways, we're calling these demonstration projects. So we have colleges across the state who are doing these things really well already. So these are turnkey projects. So in year 1 of Vision 2030, the goal is to identify these turnkey projects and then bring those colleges together along with their partners and figure out how to scale this work and then take it across the whole state and across the whole system. The third one there, I've been given the 2-minute warning there. So worker-learner projects, so removing the policies and funding barriers that get in the way of doing the work. So that's an essential piece in the systemic barriers that often prevent students from pursuing success and often put them on exit ramps instead of on ramps. And then the last piece is pathways for workers with low income. And so this is really focusing on those particular populations of learners to dismantle those barriers and bring them into the community college to get those credentials and certifications. Next slide, please. Is that it? Oh, 2 more. Okay, and before we jump there, let me just say this very quickly to kind of pull this all together. 4 of our demonstration projects are focused on the nursing shortage, mental health, and veterans, and then the education, early childhood education. So that's how we're bringing all this work together to say, how can we get community health, someone who's in a medical billing position, for example, to put them into a community health program, and then eventually get them to go from non-credit to credit, and then to a transfer into, a science undergraduate degree, and then on into, maybe one of these apprenticeship programs. So, thank you very much for your time. Appreciate that, Jeff.
All right, if I could ask Ian, come on up, Ian. He's resisting, but I really want him to be up here. Let me just say while Ian's getting up here that my 2 favorite phrases today were when Katie said open the floodgates and when Dawn said turnkey projects. I think we have a turnkey project and we're ready to open the floodgates. Ian, come stand near the microphone here. Oh, you got one. Okay, good. So look, Ian Shore, my life changed here at UCSF when Ian joined. And actually, I got to be on the interview committee that interviewed Ian to join the University Development and Alumni Relations Office. And that was a blessing because we talked during the interview about how I think your mother is a nurse navigator, or was, maybe she's retired now, but he really gets it, like in a way that only you can get it if you've been exposed, through your whole life. So, so I was just thrilled when UCSF hired Ian. And then, he's become, I think, the next generation of development is really thinking, of course, it's always been about, and it always will be about raising funds. That's super important. But Ian has just been a strategic thought partner and architect of how we grow this program and how we communicate about it with all the stakeholders and all the people we need to bring along. So I cannot be more grateful to have Ian as a partner in this. And really this whole event came about because Ian said, we've done a few small salons. It's time to think bigger. It's time to put together a symposium. So he's constantly leading the way in this kind of way. So thank you, Ian. And I know you also have a team of people who help you. I want to thank them. So we thought we would wrap up by kind of ping-ponging back and forth a little bit. If I can get the next slide, I'll probably mess it up if I try to. Thank you. So we wanted to end with a call to action. And so this is going to be brief. We just have 2-3 minutes here. But do you want to take the first one, Ian?
Okay, sure. So what we thought about when we were coming up with this call to action is just for our different constituencies, our different audiences, what are the things that you can do to help this work forward from the place that you sit and the place that you occupy in the healthcare system. So for our patients, it really is being able to point out the gaps, point out where discrepancies and missing pieces are so that a program like ours can come in and help fill those gaps. It is answering those surveys. It is participating in that way. It is being the squeaky wheel in some way, but it's also an opportunity to raise your voice to the things that are going well, the things we need to do more of, the things that are working, so that we can try and continue to do that and build on top of that type of success. Does that cover it?
Yeah, I think so. And then, Well, in the interest of time, there's a lot more we could say about all this. But in the interest of time, I think when we think about students, I'll take this one. I work so closely with you all, and you do such a great job. And what I want to see you and help you do is embrace your power to change your own life. That's the first thing, because I think we do offer this opportunity, and to recognize that you're ambassadors for this program, and you're actually also changing the system. So your leadership, you've heard from two of our great leaders. There are many others out of the 50, but Alondra and Safi, among others, have really contributed to changing healthcare in UCSF, and now blazing trails for this program, where, as I said, we have 50 students now. We should be aiming for 500, 5,000, and 50,000, and collectively, the power of that group to change healthcare and really extend the navigation workforce and extend the diversity of that workforce. So keep doing what you're doing with even more conviction. And I want you all to be high reliability interns, and that's what this is really all about. So thank you for everything you do. Ian, do you want to take healthcare systems?
Sure. For all of those folks who are on the healthcare side, the delivery system side, it really is an opportunity to be a leader, blaze a trail in breaking down some of the silos that we see in the healthcare systems. Being able to take a program like this or extend the workforce in this meaningful, impactful way that is addressing all of the people of California, and frankly speaking, we can think even bigger than that and go, all of the disparaged communities across the country, all of the opportunities we have to really extend this workforce via telehealth medicine, via boots on the ground, access to care. And for healthcare systems to realize that there are a lot of people that we've missed the mark on, and trying to make changes in creative ways and thinking differently, and working with other people and other leaders in the space to make those types of changes.
And so specifically, if you're here with a system that's already working with us, let's figure out ways we get more interns, more opportunity, more navigators to be extended. And if you're visiting from a system that wants to work with us, we absolutely want to work with you and sign those affiliation agreements, or leverage the existing affiliation agreements, and get you on board as placement sites. For educators, I can speak a little bit to this one. We work a lot with, when we heard from the community college system and perspective, there's so much to do, and already so much good work that we want you to continue in terms of innovating with the curriculum to orient your students to healthcare careers, which are well paid and good jobs and good careers, meaningful work, contribution work. And so just little examples like having, let's say, medical Spanish, not just having language courses, but even starting to tilt your language programs to how can we have medical Spanish or Cantonese or whatever the language might be, so that students are learning healthcare terminology. We could have even very fluent students taking these courses and understanding healthcare terminology, and then being even better navigators in the system. That's just one example among many. There's IT, electronic health records, the economics and history and evolution of the healthcare system, many, many opportunities. So keep up the innovation and in the educational space. And then finally, policymakers.
And if we're thinking about pie in the sky, huge ideas and opportunities, policymakers really do think, at least I think, and I think Jeff agrees, that there's an opportunity to really shape the future of healthcare equity, not only in the state of California, but more broadly than that. I've seen it happen firsthand, just when it comes to how complicated it is to get a prescription filled, and going, there's some laws still on the books that it has to be a handwritten prescription, and you can't actually send something in electronically in some states and things like that. Just being able to modernize what healthcare looks like from a policy perspective to make programs like this, not just the program, but ease of care, accessible care, something that is on the books, that is something that our state is able to provide and be able to do right by our patients. So for our policymakers and people who are connected to policy, just thinking about ways to really make that next step in our state, both for practitioners and for our patients. How can we make more equity on a policy perspective?
And that's it. We're leaving you with this call to action. We will be in touch. If you will take your surveys and put them in the middle of the table, that'll be my cue to pick them up later. if you'd like to stay and mingle, please do. I think there's still some
There's
dessert.
still some desserts, and there's the coffee and tea station that's still
Yeah.
available. But before
So-
we let everybody go, we want to commemorate this as our first symposium. We're going to try and get everybody in one group shot. We're going to try and do this as quickly as possible, and it'll give our valets a little bit more time to pull all the cars up. So we're going to stall for time a little bit and try to get everybody for one quick picture.
Come up to the stage. I think the AV team is going to put a background on, please, for the slides. And if we could all, don't be shy now, please come up to the stage. And we'll be in 2 rows. If you're maybe taller, I guess, be on the ground. And if you need a little height to be seen in the picture, stand up on the stage. And thank you all for coming. This has been wonderful.